So gout is a really painful inflammation arthritis. Some people are almost embarrassed about coming forward with gout because they think it's a bit of a joke type of condition. I can promise you it's no joke. This is a serious condition. It causes exquisite pain in the joints, particularly joints of the feet or the fingers. Men are more at risk than women. Generally, other risk factors are things like carrying extra weight, drinking too much alcohol. But I would often say to people that the majority of the reason you get gout is not your fault, okay? It's to do with the way your metabolism is set up, particularly the way your kidneys get rid of salts and other waste products, and the way your liver metabolizes. The effect of things like alcohol and weight is a small effect, in honesty, but the majority of it is genetically determined. There are some other medical conditions linked with gout. So, for example, people undergoing chemotherapy, people who've got psoriasis, people who are on certain blood pressure medicines can be linked. So many causes, but it's a very intense inflammation arthritis that is one of the few types of arthritis that can be cured. So the classic symptoms are a very, very rapid onset of pain, swelling, redness, particularly in the joint that's away from the middle of the body. So, for example, the big toe or the ankle or the foot or even a finger. Much less common, very, very rare, in fact, to get it in a shoulder or a hip. Okay, can affect knees, perhaps, or elbows. The classic thing about gout is it goes from having a normal joint to being in intense pain, the maximum pain, even within 12 or 24 hours. Okay, there's few types of arthritis that come on so fast, and as I say, the joints swell, become red, hot, exquisitely painful. And people often will wake up and even in the middle of the night can't even bear the bedclothes on their foot. So it's incredibly painful, one of the most painful forms of arthritis. Yes, so it's very treatable, and yes, it can be prevented. Treatments are, first of all, to get rid of the acute inflammation. That can be done with either anti-inflammatory medicines like naproxen, ibuprofen sometimes, or another drug called colchicine in modest doses. If that doesn't work quickly within a day or a few days, then we sometimes use a very short course of prednisolone steroid just for 5 days, and that's very, very effective. But that's not the end of it, because once somebody's had gout, there's a very, very high chance they'll develop it again. And so then we need to really start thinking, particularly if people have had a second episode or a further episodes, or have complications of the gout, such as the kidney function starts to be affected or the blood pressure is high, then we start thinking about preventative treatment. This is usually given first line with a drug called allopurinol, but there's a few things to be aware of when starting allopurinol. Firstly, small percentage of people are allergic to it, just about 3%. But we have to warn people that if they get a rash or a fever when they start this, they should stop it straight away. The second thing is you have to start slow and build up over the course of 4 to 6 weeks. And the most important thing is, for the first 6 months of treatment, you will need something else to prevent a flare-up. Allopurinol, if you like, starts to mobilize all the gout crystals that have been dissolved in the tissues, but in so doing, in the first 6 months, it can flare up an episode. Okay, and then people throw the medication away because they get gout and they say that stupid medicine doesn't work. So what I say to people is, look, you need something just to stop a flare up during that first 6 months, and I tend to use colchicine, just a single tablet a day, or a very low dose of an anti-inflammatory, just for that first 6 months to stop them having major flare-ups or flare-ups. But once the uric acid level, which is the crystal in the blood that causes gout, once that uric acid level is down to the correct level, then you won't get another episode. So it's a curable disease, but it has to be treated quite carefully in that first 6 months, because it's very common to get a little flare up, and we have to just kind of manage that. Other quick things: when you have an acute episode, ice, resting the joint, elevating the joint. These are all quite important and useful things. Keep hydrated. Try and cut down on alcohol, because that stops you getting rid of gout crystals. And taking some extra vitamin C, just a single vitamin C tablet a day. Key things with gout are that it's important to try and get back to a normal weight, because when people carry extra weight, particularly around their belly, it changes the whole metabolism. So people who have other health conditions like high blood pressure, high cholesterol, diabetes, may also get gout as part of that whole spectrum. It's all related to the one thing, which is carrying this extra weight. So I say to people, look, gradually try and get back to your ideal weight, but don't do any crash diets. I often find people have cut out loads of things from their diet and make their life very, very miserable. But really, truthfully, the amount you can alter the uric acid level, which is the acid that causes gout, is not that much just from dietary modification. But the key thing is to cut down on alcohol. Alcohol really does stop your body getting rid of uric acid. So cutting down on alcohol significantly to well within normal range, drinking plenty of fluid, trying to get to your ideal weight, staying hydrated, and an extra bit of vitamin C seems to also help with uric acid levels, so 500 milligrams a day. But I say to people, please don't make life too miserable cutting out every known source of protein in their diet, because really that's not particularly required.